Welcome back to Dr. Health Hub. Today we're going to talk about a challenge that affects millions of women worldwide: weight management. It's not just about body image, but about health, hormones, and long-term well-being. That's right. According to updated medical guidelines, including UpToDate and AMBOSS, weight regulation in women is influenced by a complex mix of hormones, lifestyle, and medical conditions. Understanding these factors helps us manage weight safely and realistically. Let's start with causes. Hormonal shifts are at the top of the list. During puberty, pregnancy, and menopause, estrogen and progesterone fluctuate. These changes influence appetite, fat storage, and metabolism. For example, after menopause, fat tends to accumulate more in the abdomen due to lower estrogen levels. Another key factor is lifestyle. Many women juggle work, family, and social responsibilities. This often leads to irregular eating patterns, higher intake of processed foods, and limited time for exercise. Stress also plays a major role. Cortisol, the stress hormone, signals the body to store more fat, especially in the belly. And don't forget medical conditions. Polycystic biliary syndrome, commonly called PCOS, is one of the most frequent reasons women struggle with weight. It creates insulin resistance, making weight loss more difficult. Thyroid disorders, especially hypothyroidism, also slow down metabolism and contribute to weight gain. Certain medications, such as those for mood disorders or hormonal therapy, may also play a role. Now, what about symptoms? The obvious one is gradual weight gain, but the picture is broader. Women often report low energy, fatigue, and difficulty sleeping. With PCOS, we might also see irregular periods, acne, or excess hair growth. With hypothyroidism, we see tiredness, constipation, and dry skin. These symptoms remind us that weight issues are usually signs of deeper physiological processes, not just overeating. Exactly. Let's move into management. According to the latest guidelines, sustainable treatment starts with lifestyle modification. Crash diets are strongly discouraged. They slow metabolism and cause rebound weight gain. Instead, women are advised to follow a balanced, calorie-controlled diet, more whole grains, vegetables, lean proteins, and healthy fats, while limiting refined sugars and processed foods. Physical activity is another cornerstone. The recommendation is at least 150 minutes of moderate aerobic exercise per week, like brisk walking, cycling, or swimming, combined with strength training at least 2 times a week. Building muscle improves basal metabolic rate, which means more calories burned even at rest. Sleep and stress management are also emphasized. Inadequate sleep disrupts appetite hormones like leptin and ghrelin, increasing cravings for high-calorie foods. Stress reduction strategies such as yoga, mindfulness, or breathing exercises help lower cortisol and prevent stress-related weight gain. In some cases, medical treatment is considered. For women with PCOS, managing insulin resistance with lifestyle plus targeted therapies is important. For hypothyroidism, thyroid hormone replacement is the standard of care. However, guidelines always recommend these approaches under medical supervision, never self-medication. And let's not forget prevention. Guidelines highlight early education and awareness. Women who adopt healthy lifestyle habits before major life transitions, like pregnancy or menopause, tend to maintain better weight control in the long term. Preventative care also means regular health checkups. Monitoring blood sugar, cholesterol, and thyroid function allows early detection of metabolic disorders. Screening is especially important if there's a family history of diabetes, obesity, or heart disease. And prevention isn't only physical. Emotional well-being matters too. Women who set realistic goals, avoid fad diets, and focus on self-compassion are more likely to succeed. Having social support, friends, family, or community groups also improves long-term outcomes. To summarize, weight management in women is shaped by hormones, lifestyle, and medical conditions. Symptoms extend beyond the number on the scale, affecting energy, mood, and overall health. Treatment relies on steady lifestyle changes, balanced nutrition, regular exercise, stress control, and enough sleep, sometimes with medical support when needed. And prevention means starting healthy habits early, staying consistent and caring for emotional as well as physical health. Well said. Remember, the goal is not quick fixes, but long-term balance. Every small, consistent step makes a difference. And as we always say here at Dr. Health Hub, your health is your wealth. Take care of it wisely, and it will take care of you.